Your recovery from cervical surgery.
You should have a follow-up appointment already made by our staff at the time of your hospital discharge. If not, please contact our office at 920-725-9373. Incision Care. Your incision may be closed with sutures, steri strips, or staples. Our team will teach you all the details you need to know to avoid infection before you leave the hospital. You'll need to wait at least 48 hours after surgery to shower. Avoid submersion in baths, hot tubs, and swimming pools until your incision is completely healed. Use ice on your incision to help with pain relief. It can be used 20 minutes at a time, every few hours as needed. Don't apply the ice directly to the skin, and do not use heat on your incision. Pain control. You'll be given a prescription for pain medication like Percocet or Vicodin. Use as directed by your provider for severe pain only. Note that narcotic pain medication can cause constipation, dizziness, nausea, headache, and decreased energy. A muscle relaxer may be prescribed to help with any tightness, stiffness, muscle cramping, or spasms. Have plenty of Tylenol on hand at home after your surgery. Take it for moderate pain, 325 to 650 milligrams every 6 hours as needed, unless it's contraindicated for you. Don't exceed 3,000 milligrams in a 24-hour period. NSAIDs like Advil, Motrin, Meloxicam, and Celebrex and Aleve should not be taken for 3 to 6 months following a fusion surgery. Please discuss with your surgeon prior to restarting any of these medications. Constipation. Constipation is a common side effect of anesthesia and narcotic pain medications. We recommend that you drink at least 8 glasses of water, eat 2 to 3 servings of fruit, and walk as much as you can tolerate daily to help prevent it. Use over-the-counter medications like Miralax and Senokot to take daily while taking your pain medications. Continue to take them as long as you are taking your pain medications and you are back to your normal bowel routine. Call your care team if you've not had a bowel movement in 3 to 4 days after surgery.
Cervical collar. You'll be sent home with a cervical collar and will be given specific instructions regarding its use at the time of discharge from the hospital. If instructed to wear it at all times, that may also include sleeping. You may remove your collar for showers and shaving unless otherwise told by your surgeon. Your collar may need to be worn for up to 4 to 6 weeks. The length of time will be addressed at your follow-up appointment. You'll have an extra set of collar pads to change out as needed. Wash them with dish soap and water and let them air dry. Please wash and change your collar pads every day until your incision is fully healed to help prevent infection. After your incision is fully healed, you can wash and change as needed. Reference the Vista Patient Collar Handbook for any questions. And please watch this video to ensure proper collar placement. If you are a fusion patient, you'll need to quit smoking. Smoking prevents bone fusion. Continuing to smoke significantly increases the chance that you will need additional surgery to repair your fusion.
Driving. No driving until after your first follow-up appointment. You shouldn't drive while on narcotic pain medication. After cleared for driving, remember that your mobility will be limited and exercise additional caution. Rely on your mirrors more than twisting your body. Activity and exercise. Let pain be your guide. This is not a time to catch up on housework or projects. You are off of work to rest and recover. Your main focus until your first post-op appointment is walking, resting, using ice, and staying on top of your medications. No stretching, exercise, or strenuous activity. No bending at the waist. No twisting and reaching overhead. Avoid bending and lifting objects greater than 10 pounds, about the size of a gallon of milk. Sleep in your position of choice. Resume sexual activity after your first follow-up appointment as you feel comfortable to do so. Walking is encouraged and stair climbing is permitted. Short, frequent walks are preferred after surgery. Get up and move around every 1 to 2 hours. You can start with laps around the house and then gradually increase your distance as you feel better. Prescription refills. Call our office at least 3 days before you run out of your medication so that your provider has time to submit your refill to the pharmacy. Don't wait until you run out of your prescription. Same-day refills are not guaranteed. Call during regular business hours of Monday to Thursday from 8 to 4 and on Friday from 8 to 3. Call before 12 p.m. on Fridays to ensure your prescription can be refilled prior to the weekend. The on-call physician will not refill prescriptions over the weekend. Contact us if you develop any of the following symptoms: increased pain not improved by pain medication, a fever of 101 degrees or more, redness, swelling, drainage at your surgical site, increased or new neurological symptoms such as confusion, weakness, numbness, or tingling, or difficulty emptying your bladder. We wish you a healthy and speedy recovery. Thank you for the opportunity to care for you.